Complementary feeding is the process of giving foods in addition to breast milk. This process should start around 6 months of age and should include balance and variety in both food and textures. There is a discrepancy between parents' knowledge of infant feeding recommendations and practices during the complementary feeding process. Compliance with the infant feeding recommendations could lead to a decrease in the risk for obesity and diabetes, higher intelligence, lower morbidity and mortality risks, and possible decrease in picky eating. Parents' presence on social media is growing, but online nutrition interventions have been underutilized in previous research. The purpose of this study was to investigate the effectiveness of an online nutrition education program compared to an in-person traditional nutrition education program. Specifically, the study will measure the nutrition-related behavioral intentions and self-efficacy outcomes of participants from both programs. Participants included new parents whose infants were less than 6 months. They completed either an online or in-person course. Survey responses were compiled into 4 scale variables, which included solid food introduction intention, breastfeeding intention, solid food introduction confidence, and breastfeeding confidence. The change in scores were measured between in-person and online participants, as well as in the online group alone, using non-parametric independent samples, Mann-Whitney U test, and the Wilcoxon-signed rank test. A curriculum previously developed was translated onto an online platform. These included 6 lessons, including the overview and recommendations, timing and tips, food allergies and safety, buying baby food and food labels, coming up with a feeding plan, and making homemade baby food. This can be seen in Figure 1. Figure 2 shows an example of a handout, including positive food parenting practices that was provided in Lesson 1 of the curriculum. Table 1 shows the demographic characteristics of our sample. The online group was slightly younger than the traditional group, but slightly less diverse than the traditional group. For the measures of breastfeeding intention, breastfeeding confidence, and solid food introduction confidence, there were no significant changes from pre to post survey between the online and in-person participants. The online participants showed a significantly greater change in intention to introduce solid foods according to the guidelines for timing, variety, and texture than the in-person participants. Online participants also showed significant improvement in scores for breastfeeding intention, solid food introduction intention, and solid food introduction confidence. A majority of online participants found the site easy to use and engaging. Qualitative questions related to improving the course showed that parents were interested in more information on baby-led weaning, more media including interactive elements and infographics, and concise information about food labels. Although parents self-selected to take an online course, the majority of parents stated that they would prefer to take the online version, citing convenience and busy schedules. The findings from this pilot study suggest that an online course for teaching new parents about introducing solid foods can be effective. Parents reported increased intention and confidence with introducing solid food according to the infant feeding guidelines, specifically with balance and variety. The measure for breastfeeding intention increased. However, the measure for breastfeeding confidence didn't. This may be due to participants who reported not exclusively breastfeeding prior to completing the pre-survey. Thus, we couldn't capture those participants. For future research, looking at whether the improvement in outcomes can be sustained after solid food is introduced is needed to figure out if challenges can arise. As the body of literature surrounding food parenting grows, more research to look at interventions before solid foods are introduced is needed. The potential for an online learning environment to teach new parents about how and when to introduce solids is presented in this study. New parents may find online learning especially useful due to the benefits of learning at home and on their own schedules.